The endocrine system is the collection of glands that produce the hormones that regulate metabolism, growth and development, tissue function, sexual function, reproduction, sleep, mood, among other things. So these are all the this is the system that produces the hormone that regulates all these functions in our body. The endocrine system, what it does, it makes the hormones that control the moods, growth, development, metabolism, organs and reproduction, and it controls how your hormones are released and sends these hormones into the bloodstream so that they can travel to other body parts. So the main parts of our body that produces the hormones are hypothalamus, pituitary gland, thyroid and parathyroid glands, pancreas, adrenal glands, then placenta during pregnancy, pineal gland, thymus, ovary, testicle. So these are some of the parts of the body that produces the hormones. Hypothalamus will stimulate the pituitary gland to produce all these hormones. Okay, these are again divided into anterior and posterior pituitary. Okay, from the anterior pituitary they will release a growth hormone, prolactin, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone and luteinizing hormone. And from the posterior pituitary they will release the oxytocin and antidiuretic hormone. And also there are other parts, like from the adrenal medulla they will produce the epinephrine and norepinephrine. From the adrenal cortex they will release the mineralocorticoids, glucocorticoids. Then pineal gland will produce melatonin. Parathyroid gland will release a parathyroid hormone that is responsible for the increase of calcium. Then thyroid gland will produce the T3 and T4, then calcitonin. Pancreas will produce the beta cells and alpha cells. So first let's discuss on what is hypothalamus. The hypothalamus is a small but important area in the center of the brain. It plays a main important role in hormone production and helps to stimulate many important processes in the body, and is located in the brain between the pituitary gland and the thalamus. So this hypothalamus, this will stimulate the pituitary gland. Okay, then the pituitary gland will then stimulate the other organs to release the hormones. It plays a main important part in essential functions of the body, like body temperature, thirst, appetite, weight control, emotions, sleep cycles, then sex drive, childbirth, blood pressure and heart rate, production of digestive juice, balancing body fluids, etc. Okay, so first let's discuss on the hormones of the hypothalamus. Hormones secreted by hypothalamus include the antidiuretic hormone. What it will do, it will increase how much water is absorbed into the body by the kidneys. So this is also known as the water hormones. Then corticotrophin releasing hormone. This will help in the regulation and metabolism and immune response by working with the pituitary gland and adrenal gland to release a certain steroids. So this will be responsible for the immune response and metabolism. Then gonadotrophin, these are the ones. Then oxytocin, which help in the these are involved in several processes, including the release of breast milk, then body temperature, regulating sleep cycles, etc. Prolactin also help in the production of milk in the lactating mothers. Then thyrotrophin, this will release the hormone that activates the thyroid. Pituitary gland is a small and oval shape, located behind the nose near the underside of your brain. It is attached to the hypothalamus by a stalk-like structure. Okay, so in the pituitary gland, it is divided into anterior and posterior pituitary gland. We have already discussed what are the hormones which are under the anterior and which are under the posterior. So let's see now the anterior lobe. From the anterior lobe, growth hormone will be released. Growth hormone is responsible for regulating the growth and physical development. Then thyroid stimulating hormone, this will release the T3, T4 and calcitonin. Then adrenocorticotrophic hormone. It will stimulate the adrenal glands to produce cortisol, then follicle stimulating hormone, luteinizing hormone, prolactin, endorphins. So these all are under the anterior lobe. Then in the posterior lobe, vasopressin and oxytocin. Okay, vasopressin is the antidiuretic hormone that helps our body to conserve water and prevent dehydration. Then next, oxytocin. This hormone stimulates the release of breast milk. Then it also stimulates the contractions of the uterus during labor. So let's see next, the pineal gland. Pineal gland is a small endocrine gland located in the center of the brain between the two hemispheres. Then the pineal gland will produce melatonin. Okay, melatonin is a hormone from the pineal gland that helps to regulate the biological rhythms such as sleep and wake cycles. So all the activities which are related to our sleep and wake cycles, these are controlled by the melatonin. Thyroid gland. Next is thyroid gland. It is a butterfly-shaped gland that sits on our front of the neck. Okay, the thyroid lies below the Adam's apple along the front of the trachea. First, from the hypothalamus, it will stimulate the pituitary gland to produce the thyroid releasing hormone. Then it will again stimulate the thyroid stimulating hormone to produce the three hormones, that is T3 triiodothyronine, T4 that is thyroxine, and then the calcitonin. This thyroid makes these two main hormones, this triiodine and thyroxine. Then other hormone which is also produced is the calcitonin, which will be involved in regulating the level of calcium and phosphate in the blood. Then next is the parathyroid gland. Parathyroid glands are responsible for producing the parathyroid hormone, which is involved in the regulation of blood calcium levels. Then next is thymus. Thymus is a small organ which is behind the breastbone that plays an important function both in the immune system and endocrine system. So this thymus gland will produce the different hormones like thymopoietin, thymulin, thymosin, which will help in the fighting of infections and training of the T lymphocytes. Then next is adrenal gland. The adrenal gland are located above the kidneys. So these adrenal gland are composed of two parts, cortex and the medulla, which are responsible for producing the different hormones. First, the cortex, the adrenal cortex. This will produce the two main groups of corticosteroid hormones, that is the glucocorticoids and mineralocorticoids. The glucocorticoids release is triggered by the hypothalamus and the pituitary gland. Then the mineralocorticoids are mediated by signals triggered by the kidneys. When the hypothalamus produces the corticotrophin releasing hormone, it stimulates the pituitary gland to release the adrenal corticotrophic hormone, that is ACTH. These hormones in turn alert the adrenal glands to produce the corticosteroid hormones. Okay, then the glucocorticoids which are released by the adrenal cortex are the hydrocortisone and corticosterone. The hydrocortisone, also known as cortisols, it regulates how the body converts the fats, proteins, and carbohydrates to energy. Then the corticosterone, this hormone works with the corticosterone to regulate the immune response and suppress the inflammatory reactions. Next part is the adrenal medulla. This adrenal medulla secretes two types of hormone, that is epinephrine and norepinephrine. This epinephrine is also known as the adrenaline. Okay, it is responsible for the rapid response to stress by increasing the heart rate, rushing of blood to the muscles and brains. So it spikes our blood sugar level also by helping to convert the glycogen to glucose in the liver. Then norepinephrine, it is also known as noradrenaline. This hormone works with epinephrine in responding to stress. However, it causes vasoconstriction, the opposite of epinephrine. It will do the opposite of epinephrine, that is vasoconstriction, narrowing of blood vessels, narrowing of constriction of and all. Okay, so this epinephrine and norepinephrine, these are produced by the adrenal medulla. So this is all about the adrenal glands. Next is the pancreas. Pancreas is an abdominal organ that is situated behind the stomach and surrounded by other organs, including the spleen, liver, and small intestine. This pancreas plays an important role in digestion and regulating the blood sugar. Okay, the pancreas maintains the body's blood sugar balance, blood glucose. Then primary hormones of the pancreas include insulin and glucagon, and both regulate the blood glucose. Then diabetes is the most common disorder associated with pancreas. Then hormones of the pancreas include gastrin. This hormone aids in digestion by stimulating certain cells in the stomach to produce the acid. Then next is glucagon. Glucagon will help in the insulin maintaining the normal blood glucose by working in the opposite way of insulin. How it will work? It will stimulate our cells to release glucose. Then this raises our blood sugar. Then insulin. This hormone regulates the blood glucose by allowing many of our body cells to absorb and use glucose. Somatostatin. When the levels of other pancreatic hormones such as insulin and glucagon gets too high, then somatostatin is secreted to maintain the balance of glucose or salt in the body. And vasoactive intestinal peptide. This hormone helps to control water secretion and absorption from the intestines by stimulating the intestinal cells to release water and salts into the intestine. So these all are the hormones which are secreted by the pancreas, and the important ones are the glucagon and insulin, which helps in the regulation of blood sugar inside the body. Then next is the ovaries. The ovaries are oval-shaped and about the size of a large grape. They are located on the opposite ends of the pelvic wall on either side of the uterus. Then the main hormones secreted by the ovaries are estrogen and progesterone, which are both important hormones in the menstrual cycle. Then what will do? Estrogen production dominates in the first half of the menstrual cycle before ovulation. Then progesterone production dominates during the second half of the menstrual cycle when the corpus luteum has formed. So both the hormones are important in preparing the lining of the womb for pregnancy and the implantation of fertilized egg or embryo. If conception occurs during any of the menstrual cycle, then the corpus luteum doesn't lose its ability to function and continues to secrete estrogen and progesterone, allowing the embryo to implant in lining of the womb and placenta. At this point, the development of the fetus begins. So the ovaries will secrete the estrogen and progesterone, and it will help in the maintaining the menstrual cycle and also during the development of the baby fetus. Then the testes. The testes are twin oval-shaped organs about the size of a large grape. They are located within the scrotum, which is the loose pouch of skin that hangs outside the body behind the penis. So the main hormone secreted by the testes is the testosterone, okay, which is an androgenic hormone. This testosterone is secreted by the cells that lie between the seminiferous tubules known as the Leydig cells. These testes also produce inhibin B and anti-mullerian hormone from the Sertoli cells and insulin-like factor 3 and estradiol from the Leydig cells. So testosterone is important in the development of male reproductive organs in the fetus and also causes the development of male characteristics. So these are the functions of the testosterone. Then so this is the end of the different hormones and the different. After knowing this related anatomy and physiology, now we can clearly identify what are the disorders related to the disbalance or the imbalance of these hormones. So the endocrine system disorders, some of them I may point out, that is acromegaly, okay, when the pituitary glands makes too much growth hormone and the bones get bigger. It usually affects the hands, feet, and face. It usually starts at the middle age. Then adrenal insufficiency, Cushing's disease. Cushing's disease occurs when the body makes too much cortisol. Then hypothyroidism. Thyroid gland will produce more hormones. Then hypothyroidism, when the body doesn't make enough thyroid hormones. Then hypopituitarism, then when the pituitary gland doesn't make enough of the certain hormones. Then multiple endocrine neoplasia. This will affect the endocrine system largely. It will cause tumor on at least 2 endocrine glands or in other organs or tissues. Then polycystic ovary syndrome, imbalance of reproductive hormones, that is estrogen and progesterone. Then precocious puberty. So these all are the some of the disorders related to the endocrine system abnormalities. So the summary you can go through, which are the hormones under the posterior pituitary, under the anterior pituitary. Then what are the hormones released by the thyroid gland, parathyroid gland, adrenal cortex, adrenal medulla, pancreas, testes, ovaries, thymus, and pineal gland. So these all are under the endocrine system.